Okay. Okay, we're live. And hello and welcome to the Global Mental Health Awareness Show, where we have open conversations with the youth about mental health. I'm your host, KATINDA, the author of The Big Comeback and founder of the Confidence and Self-Esteem Academy, and also one of GYMHA's special board advisors. In today's show, we're blessed to be in the presence of three amazing panelists. And our first panelist is Edith Wanyoni. Edith is a counseling psychologist, GYMHA's advocacy manager, and ambassador. Hello and welcome to the show, Edith.
Thank you very much, KATINDA. It's a pleasure always being here. And I'm so excited to be here today.
Nice to see you.
Good to see you, Dr. Elizabeth.
Good to see you. And our second panelist is Dr. Elizabeth Jani. She's a mental health specialist, research director, and trainer at GYMHA. Hello and welcome to the show, Dr. Elizabeth.
Hello, KATINDA and Edith. I'm happy to be here again, and I am looking forward to having another nice and warm discussion related to mental health so that we can continue educating our youth.
Thank you. Now we have a third panelist who I don't see, he's not here yet. That's Abdi Aiden. We'll just introduce him as he comes along. Now, in our conversation today, our guest will be giving us an insight on post-traumatic stress disorder, PTSD. But before we begin, I always like to ask, how are we feeling today? Dr. Elizabeth, how are you feeling?
I am very excited to be here and to see Edith again. I don't know where she gets lost after we finish the show. She just disappears. In the team here, she should be sending me her number so that I can connect with her in Kenya. I am happy to be here and to be part of this team.
Yeah, it's great. Edith, how are you feeling today?
Today, I just feel happy because of the gift of life. And things have just been going good for me lately. So I'm just happy. Yeah, thank you.
Fantastic.
How are you?
I'm doing fabulous. I mean, I say the fact that we're awake, we're alive, we're breathing, that is my benchmark. So as long as we're alive, we're breathing, everything else is easy to do after that. It's not so bad because we are here and we can make that obviously change, or we can make those decisions that impact our lives as well if we do the right thing. So now, one thing I know, this is a topic that is very critical because it affects everybody. So we know that there is a major shift in everyone's life at the moment. COVID-19 was introduced to our lives, and life will never be the same again. So many of us are suffering with post-traumatic stress disorder, PTSD. So what exactly is post-traumatic stress disorder? Dr. Elizabeth.
Thank you, KATINDA. As you said, this is a very crucial topic for all of us because it cuts across ages, class. It doesn't discriminate. So we are saying that post-traumatic stress disorder is a condition that comes as a result of experiencing a traumatic event or occurrence, and the individual is not able to recover after that experience or witnessing a terrifying event. We are also saying it is a trauma and stress-related disorder that develop as a result of what an individual has gone through.
Yes. What about Edith? What would you like to add to that?
Yeah, thank you very much. Just to recap on what Dr. Elizabeth has said, PTSD is a mental health disorder that occurs in people who have witnessed or experienced a traumatic event. And some of these traumatic events could be like a natural disaster, people who are prone to war countries or violence, sexual abuse. And like recently with COVID-19, trauma has been there, and just witnessing like people being buried, like they are being buried not, for example, like in Africa, we are not used to people being buried the way they are being buried right now. So that could be traumatic to us. Yeah, so that's what post-traumatic stress disorder is. Yeah.
And is post-traumatic stress disorder a mental illness? You mentioned it is a mental illness. So is that actually a mental illness?
Yeah,
Edith?
I think, yes, it is a mental illness because it affects the thinking, the feeling, and the behavior of a person. So, yes, it is a mental illness.
Wow, okay. And Dr. Elizabeth, did you want to add anything to that about it being a
Yes,
disorder being a mental illness?
yes. As Edith has said, when we talk about mental health, we are talking about our feelings, our thoughts, and our behavior. And therefore, post-traumatic stress disorder falls under mental health conditions that affect each individual depending on the event that has occurred. And I think it is better we also talk about what trauma is and what stress is, so that when we now talk about the combination, the listener can be able to verify and understand in a better way what it is. So we say that trauma is an emotional wound. It is a psychological wound. Therefore, it is affecting our feelings, our emotions that cannot be seen by another person. But when we look at stress, we say that stress is a body's reaction to an occurrence. When you are not able to cope with a situation, how does it present? This means it is your own reaction. It can be physical, it can be cognitive or mental, it can be emotional. And when you combine them, you realize that now it goes beyond an individual's way of coping. And when the trauma or the wound is not dealt with, or the stress is not handled, what develops is now the post-traumatic stress disorder. That is why it relates to post after the incident and the stress that an individual is experiencing. Therefore, it becomes a combination of all those challenges that you are going through as a person.
Wow, thank you for differentiating the two, because we don't actually know the difference because we don't know. Thank you for enlightening and being insightful with that difference. Now I see we've got Abdi K. Aiden. Hello, Abdi. How are you?
I'm good, thank you.
Thank you for joining us today. And we're just talking about post-traumatic stress disorder. And Dr. Elizabeth was explaining the difference between stress and post-traumatic stress disorder as well. Now, what causes post-traumatic stress disorder? Abdi, do you want to give us a bit of an insight on that?
My experience of being a youth worker and working with young people, also completing my education about mental health, welfare, and lesson. And my experience is sometimes is bad experience. So it can trick, especially when something reminds them. I work with a lot of refugees, a lot of young people with disadvantage and mainstream, and I find that coming from a very disadvantaged background, but also reminds them what happened to them 10 years later, if that tricks it, it might cause that, if that makes sense.
Right, right. Yes, and Edith, what would you like to add? What causes post-traumatic stress disorder from your own experience? Like what type of things happen to people? I mean, you said before, it could be war, could be sexual assault. There's a lot of things, but what else would you really say could be a result of?
Okay, so like a few years ago, actually in 2017, I was working for Highest Refugee Trust as an intern counseling psychologist. So my clients were refugees. And what I'd say is uh, they had gone through so much trauma, in, like war, sexual violence, and just watching their loved ones being killed. So that is one cause of post-traumatic stress disorder, like being exposed to such kind of trauma. And then also it could be secondhand. So like for people who are working, the frontline workers, like doctors, nurses, teachers, the soldiers, policemen, social workers, and psychologists, and maybe just in general, like humanitarian workers, are likely to experience traumatic stress because of being exposed to horrible details of trauma. And just like listening to people giving you information about trauma, or seeing what is happening to people, you're likely to be affected. So that is like secondhand trauma, which is also known as vicarious trauma. Yeah, thank you.
Wow. Dr. Elizabeth, did you want to add anything to that?
Yes, I would say that as much as we are saying there is no medical cause of PTSD, there are people who are more vulnerable to having PTSD than others. As Eden has said, we said that an event is interpreted by an individual in different ways. We could have experienced the same kind of event, but based on our coping strategies or ability, the the event will affect us differently. For example, we may be in a war-torn zone, but an individual who is able to cope has a better recovery process than a person who has challenges in his reservoir in terms of coping ability. And therefore, the way you interpret that event affects you. Those people who have other physical conditions or mental health conditions are more vulnerable than those who are, we would say, normal or okay compared to that. For example, a person who has depression, a person who has anxiety, a person who has other mental health conditions is more vulnerable. Even to recover, it takes longer. So at the end of the day, we are saying the causes, as Edith has said, it is either being a primary victim or witnessing or working with the people who have had these traumatic experiences. And therefore, you get either the primary trauma or the vicarious trauma, and also based on your other health conditions.
Right, right. Thank you for that. Now, and how is post-traumatic stress disorder diagnosed? Do you have to go to a doctor, or what do you need to do? Edith,
Okay.
did you want to? Yeah.
Yeah, thank you very much. Now, this is what I'll say. Like we said, not everyone is affected by witnessing or experiencing a traumatic event. So, post-traumatic stress disorder is diagnosed like if the if the if the feelings, or if the, what can I say, if the feelings persist for long, what you're experiencing, the symptoms actually, if the symptoms are persisting for long, like for more than a month, and some people it even takes years. So if you feel that like your symptoms are persisting for long, that is one diagnosis. And we could say that these symptoms includes like intrusive memories, like people are having intrusive and unwanted memories. The memories are involuntary, so they are there. They are feeling all these feelings, like reliving the experience through flashbacks and nightmares. And like I said, I remember working with one client who was reliving the traumatic event in a counseling session, and it was so scary for me. I remember just being like startled in the whole experience, because she was screaming and calling names. Yeah, just reacting to what she experienced during the traumatic event. Then you'll see like some people will avoid situations that remind them of the traumatic experience. They'll even avoid people that will remind them of the traumatic experience. And then people will have alterations in their cognitive and even in their mood. So you'll find that some people will not remember some very important aspects of the traumatic experience, or they just have like a distorted mood about themselves, and they'll start blaming themselves, like maybe they are the cause of what happened. For example, when it comes to like a sexual violence, you find that people are blaming themselves, and also just having like negative feelings. and not enjoying activities that they used to enjoy before, and having estranged relationships with people. They don't want to interact with people. They just want to isolate themselves. Yeah, so that is how we can diagnose post-traumatic stress disorder.
Wow, thank
Yeah,
you.
thank you.
Abdi, did you have anything to
Yes,
add?
yeah, I will add that I think that you mentioned good points there. One thing I experienced with my community was that because beginning of mental health in general issues, that the stigma is that bad, it's a very hard to address the issue. So what you're talking about, your client here, and is that what you're saying is a really nice way of helping them. But in my community, if I concentrate, what happens is we don't even say the trauma. We don't mention it. We just say, oh, you should get better. So my understanding is to help them is to normalize. If you normalize say, look, it's okay to be able to have the symptoms you have, and we'll work with you. I think that's the best way, because the Western culture of the names, the mental health and post-traumatic, all these names, we don't have. So what happens is the best way to begin with is to normalize it and say, it's okay, we can get you help, and then ask them what type of help they need. So because everyone is different, everyone, we talk about sexual abuse and things like that for women, but what about old women, or what about men or young person? So the way they receive the information are different. So I always say, I make them like, it's okay to be able to, you're normalizing, like you're okay, you're someone and you value, and then move on to whether medication or whether they go back to their roots of doing whatever. So kind of the word I was looking for is just normalizing it, and we don't have that. A lot of people I met, African backgrounds, will say mental health is not something. We're African. We don't even we're African. We don't think about mental health issues in general. So how do you talk to them in the first place when they're saying, "Oh, you're bad"? In my community, they say, "Well, if you cry or scream, you're actually bad." So some experiences we had where a man who became violent, his own family, he couldn't express himself. No one said it's okay, like example. So for me, it's normalizing it and finding people like similar to them. It doesn't matter what background you come from, but someone say to you, look, I have that too. So that's why I always used to take them out and talk to them, maybe in the car. They don't have to look at me when I'm driving them one-on-one, working with. So I think where we're at now, if you talk about my community, that's where we're at, rather than, mainstream culture. We're not there yet. That's my experience.
Right, thank you. Thank you. Dr. Elizabeth, what would you like to add about that?
Yes, I concur with Abdi, where we are talking about challenges in diagnosis of PTSD. Reason number one is that we have turned to self-medication and self-diagnosis. And this is where we keep reminding our community members, instead of doing that, seek professional help so that we can do proper diagnosis. The other challenge is our cultural aspect. For example, in Africa, men are not expressive. They keep to themselves even the challenges that they are going through. And therefore here, what we are saying is that family members can be able to identify when a person is not okay, because we have to look at a few of the things that a person is able to do. Is this person enjoying the day-to-day activities? Are they able to participate in the daily living activities that they used to do for themselves? Are they able to do? If they are no longer interested, if they are no longer participating, that is a signal that you need to seek professional help for them. So as Abdi is saying, if you look at the diagnostic criteria that is used in CDC-10 or the DSM-5, we find that in Africa, we may not be able to follow that. but there are indicators. For example, the nightmares are common, and these are things that we can be able to deal with. Flashbacks. There is what we call hyperarousal. The person is hypervigilant. Or we have these issues of avoidance, or the person has numbed. For instance, when we have the terrorist attack, or we are a person is in the front line, like the soldiers, they are in at combat. How are they able to deal with this in the family setting, in the community setting? You can be able to identify those three issues: the re-experiencing and relieving the issue, avoidance and numbing, and the hyperarousal. Use the language that is you are comfortable with, that the person can be able to identify. However, when we come to children, they are very evident indicators, like there is a regression. The child has gone back like to peeing on bed and had overgrown that. Then there are those who get into fetal position. When they are asleep, they curl themselves into that position they were in the womb. Then sucking. If they are playing, their play is dominated by these events that they went through. Those are indicators, and we pick that, and we can be able to diagnose that the child is having post-traumatic stress disorder. If it is lasting 6 to a month or so. So at the end of the day, whether we are following the DSM-5, the CDC-10, or our cultural aspect, we are able to diagnose that.
Yeah, but I also have a question. So, like in the family setup, this is good when you're taking somebody for help, but in a family setup, how do we know and how do we help each other? Because charity begins at home. So, how do we know that somebody has got trauma, or maybe all of us have trauma? So, how do we help each other?
I would start by saying that it's what we call the primary social support. What kind of support do you give this person who has experienced that traumatic event? Are you doing negative appraisal? Like in Africa, you'll find that men are always judged based on the masculinity. Stop behaving like a child. Stop behaving like a woman. This is negative appraisal, and it affects the person so much. So the person may not seek help if you are not providing the positive support that we are giving. When it comes to parents, we are talking about positive parenting. How do you handle that child who comes to you and says she was sexually molested? Do you believe in the person? Do you blame the person? So again, I go back to the issue of children, and we say, listen first before you judge, and avoid blaming the person for the event that has occurred in their life.
Yeah,
When you do identification that they have a challenge, reach out to other people for help. Stop closing them in the closet.
Yeah. Also, go ahead.
Before I forget, I agree with you, Dr. Elizabeth. A lot of points that you made. One thing that I always work on, even myself, coming from war-torn, and I did write my memoir, and a lot of schools are reading. And one of the things I find to answer your question, a family member, is that the first thing I'll say, talk about it. The first thing you do is to talk about what happened. And you can't move on if you don't talk about what it is. And then everything that Dr. Elizabeth said, it will come in. So that's the way I would say, if a family member, my sister, or a wife, or a husband, the best way is, as you said, Dr. Elizabeth, that the man and you can't talk about things and along that line. is the first thing you do is to talk about it slowly, and then finding the support we're talking about is that if once people talk about it, is they can cry if they want to. We don't have the cry men in our culture even crying. So that's where I can say so many other things. So if we can normalize it again, that's saying let's talk about it and cry in a safe place, whatever the safe is. And sometimes you can ask people, what do you like? Like when I used to run program, young people will come to me and everyone says, oh, the young people don't know what they want. But my thing was, I'll say to one young person, the leader in the group, I'll say, what do you want to do? They say soccer. And we know we don't do soccer, but I'll say, that's okay, let me find out. So I'll find out the soccer, and all that mental health that they were crying in that will stop for a while because they're happy in that time. So you need to tackle talking about it and giving. A lot of men, especially my community and other African men, they have no jobs. The jobs they have, they're not happy. So if you ask a lot of people, are you happy driving a taxi? They will say, no, I'm not happy. And that's where the problem is, because not happy, the traumatic they went through, not talking about it, it just brings family violence.
Yes, it is. Edith, did you have something to add before we move on?
You know, I'm just thinking about what Dr. Elizabeth said, like about children. And I'm thinking some children, because of the shock, they develop like selective mutism. So they're not able to express themselves. They're not able to talk, even when you like try to prompt them. And so this is especially like to teachers who may find it like maybe the child is developing some truancy. So it's very important like to be careful when we are addressing children, and also to parents. Yeah.
Yeah, they say a lot of times things we say to children becomes their inner ear. So we have to be very careful with the language. Yeah, the language. Yeah, so if you've just joined us, we are talking about post-traumatic stress disorder and how it affects our life on a daily basis. Please click share, comment, and invite your friends to watch and ask questions, because this is something that affects everybody. And it can affect you, can affect me, can affect somebody you know. So please share this video so more people can have more information, more insight on how to deal with post-traumatic stress disorder. Now, moving forward, how does post-traumatic stress disorder affect everyday life? Abdi, did you want to?
Yeah, yes, I'll start, but then when other people are talking, you just give me more ideas. But yeah, I think daily it does affect, for example, if you are driving or you hear a noise, or if you are, I remember about 5 years ago, I was in High Point Shopping Centre, if you know Melbourne, High Point Shopping Centre, and someone had a balloon, and the balloon popped off, and I remember everyone else just went on the ground, and I was the only one standing, and I thought, oh, so what happens is when daily affecting is when you hear those type of things, reminds you, taking you a place that you don't want to be, and that's what happened. That shock with the driving, shopping, someone will yell, and you interpret differently. So someone in the shops will ask you a question, and you interpret. So it does affect day to day, and that's why I was saying before, if you talk about it and say what the problem is that you're having, then you can control day by day, and that's how I see it affecting. It will affect your relationship with families, friends, and everything. If you don't trust people, if you don't always being negative, and that's why when we talk about children before, we have to get the right help for the children, not the adults. So for me, that's what I'm thinking of day to day. It can affect your daily life.
Thank you. Dr. Elizabeth, what are some ways post-stress disorder affects everyday life?
Yes, it does affect our everyday life because it affects all our aspects of a human being. It affects you cognitively because it will interfere with your concentration, with your memory, focus, decision making. Therefore, at the end of the day, you are not going to make any rational decision or be able to do what you used to do in the initial before the trauma. The other one is that you get what we call psychosomatic illnesses that are not based on anything biological. You find that you have body aches, you are complaining of one condition from one to another. It also affects you socially. When we look at avoidance, this person who is avoiding daily activities, interacting with other people, it means his social life is already cut short. He cannot be able to live with these other people. And then behavior. What would happen, like what Edith has said? A person is screaming during the day. So other people tend to run away from you or keep off from you, or you self-isolate, meaning the person is not functioning at all levels. And therefore, at the end of the day, you find that when it comes down to screening, we have to screen and check on every aspect. What about spiritual? The person is questioning his God. His belief system is also affected. That means the person is politically affected. And you can imagine this person who is keeping to himself or herself is unproductive again in all aspects. So at the end of the day, you find that PTSD affects the person holistically.
Thank you. Edith, what would you like to add to that?
Yeah, thank you. I'd say that people will have like strong negative reactions towards ordinary things, like just hearing a bang, and they react negatively. They'll start like screaming, running. I remember a client who told me that when they hear the downpour of the rain on their rooftop, they will hide under the bed because it reminds them of the traumatic experience that they went through. So just having like negative reactions, and also isolating yourself from people, not having interest in activities that you used to enjoy before, less concentration, and nightmares, and just not being able to live a normal life like you used to live before. And I think it could also lead like to suicidal ideations. Yeah,
Right.
thank you.
Now, is post-traumatic stress disorder curable?
Yes,
It is.
it is curable. Being able to seek help, it's important to seek help early. So immediately someone starts like feeling the symptoms, it's important that they seek help early, because when you seek help early, you are likely to get better. Yeah, so it is curable.
Dr. Elizabeth, what's your belief in that?
Yes, I concur with Eddie that it is curable. The issue here we are dealing with is something that developed after an event has taken place. So that word post is telling us, can you intervene immediately the event occurs, so that you can be able to work with this person before he develops other complications. Because at the end of the day, what we do is we manage the symptoms after the event has occurred, or we treat other presenting issues because we were not able to intervene at the right time. So again, when we do management, we are looking at treatment, prevention, treatment, and post activity, so that we can be able to help the person in a holistic manner. So it is curable.
Thank you. Abdi, what would you like to add to that?
I just want to add to that is that one thing you ask the question day to day is, even after you don't sleep all night and then you get up in the morning, you probably want to eat healthy food, and you want to be healthy as physically you're not exercising. So you're not doing what the body needs. And sometimes if you tackle that issue and then still seeing someone to help you, I think we underestimate how much your body so resilient if you look after. Because once you had a good sleep and you're having healthy food and exercising, sometimes you can actually function. You might get the help after that. And we don't concentrate that too much. We concentrate sometimes medication or maybe counseling, but it's actually the person actually what they need is, I think you mentioned that before, Edith, that doing exercise what they used to do, things like that. So I would probably say that can be a little bit improved about healthy eating, healthy exercising.
Thank you. Now, just Dr. Elizabeth, just going back to that, is post-traumatic stress disorder curable? You know, it says post, like you said, so it means it's after something has happened. But why do we find that most people take so long before they actually seek for help? Is it lack of knowledge, not knowing? Why is that reason? Because I know a lot of people who have PTSD and it's just, they didn't even know it.
At times, the factors that lead to that are multifaceted. You find that there are factors within the individual, within the family and the society, and also within the field. Number one, for example, a person gets involved in a car accident, and we check for the physical signs, whether the person is wounded or not. We deal with what we are seeing. But we forget to deal with the feelings of the person, the emotions. And this is what now leads to other complications. And it is delayed. The person feels, yes, I am okay, because we never told them that when you have negative emotions, that is not normal. It is normal to feel it, but at the end of the day, we are saying, can we be able to help the individual deal with what is happening, so that he can be able to also to deal with the occurrence that has happened. So the delay is as a result of, one, lack of knowledge, cultural practices and the interventions that we do, and the lack of services. We may assume that we have got professionals within our setting, but they are very few. They cannot be able to meet the needs of the community at large. So again, the profession is not well equipped. There are very few people vis-a-vis the needs that are on the ground. So again, they are not addressed immediately.
Thank you. Thank you. Anyone else wanted to add before we move forward?
Yeah, just one quick one. I find is a stigma. The stigma is really huge to go forward. So I'll add to that. Yes.
Thank you. Thank you. So how do we prevent post-traumatic stress disorder?
And also, yeah, sorry, Katinda, just the previous question you asked, I think also just like the symptoms don't happen immediately for some people. So it may take long for some people for the symptoms to start exhibiting. Yeah.
Yeah, great. So how do we prevent it? How do we prevent post-traumatic stress disorder?
I don't think we can prevent it, because it's not in our control. You know, it's not in our control to experience a traumatic event. It can happen to anyone. So prevention, I'm not sure if we can be able to prevent it. Yeah.
Right. Abdi or Dr. Elizabeth, what would you like to add to that?
Yeah, I just add.
Sorry, Abdi, go on.
I just want to say quickly, I think the only way I can say is setting up services. You know, it's just hard to stop if someone had a car accident, as before we talked about it, or someone being hopefully got raped, or something happens. What we need is services ready for it. You can't stop that. So that's why in developing countries, the only way they can't stop certain things. The only way they can stop, and a lot of people survive, is being able to a lot of services. Like my case, when I wrote my book, there's a lot of things that I will never talk about it as a man. I did talk about it, so that gave me confidence. And like, I'm not comparing. I'm fortunate to be educated myself and that, but I can see the benefit of services around talking about it. I think that's the only way that I can see Cuba. I mean, after 2 years, I might be a little bit smarter and I learn more, and I can tell you. But for now, as Edith said, it's exactly the same. It's very hard to avoid.
Thank you. Dr. Elizabeth. What did you want to add to that?
Okay, I would say, as much as I would concur with Edith that this is individualized, we can be able to prevent to a certain extent. For example, when an event occurs, how we handle it matters very much, because what we are trying to avoid is the post. But we can deal with the traumatic experience individual immediately. And therefore, we deal with that acute stress at that particular moment, so that we prevent development now of PTSD. And here, what we need to do is to also support the families. We create more awareness on what happens after this event. What is PTSD? We need to destigmatize mental health so that we are able to get to reach out to people so that they can also be empowered to seek help. So we need to work on our support system. The other one is keeping out of harm, helping children to keep out of harm's way. For example, creating what we are calling safe spaces for children and the youth. Because, for example, those who are in the informal settlement, how do we take care of them? How do we take care of these children? Having these safe spaces will help the children, because they will be able to talk, they will be able to reach out for help. The other one is what we call early intervention. The key question here is, we are in the mental health field. How accessible and affordable are our services? So at the end of the day, you find that we still create the problem ourselves. But if we can be able to offer services that can be, our people can afford and they can access, it means we are going to prevent development of PTSD. That's my take for that.
Thank you. And how do we, or how can people manage post-traumatic stress disorder? So they've got it, they've gone for help and everything, or maybe they didn't go for help. What else can they do? Edith.
I would say, sorry. Yeah, I would say more education, educating yourself. And even the previous the question, again, it's about educating about the community, how to prevent. So if you educate the community, it means that things that happened before hopefully won't happen. So I would just say more education.
Thank you. Edith?
I think just like talking to people, expressing to people what you're feeling. When it comes to the frontline workers, it's very important to seek supervision so that you're not affected by PTSD, and also just like sharing with your colleagues. Yeah, I think that's a better way to manage it.
Right. Dr. Elizabeth, what do you think?
Yes, when we talk about management, we are saying it has already occurred. So we are looking at the three groups of people. The person who is already affected, we are looking at the caregivers, and here that is where Edith has mentioned about the frontline service providers. We are talking about therapy. Individual therapy, group therapy, family therapy. This is very, very, very relevant for us, so that we can be able to understand ourselves, to know our coping strategies, whether they are effective or ineffective. When we come to the frontline service providers, they also need to seek that supervision and to help them understand themselves and the impact this traumatic experience is having on their lives. But when we are now looking at the individual who is already suffering from PTSD, we are talking about the primary social support, that we need to ensure that they have the best support they can get within the family. Talk about medical adherence, because you realize that PTSD comes with other comorbidities like depression, anxiety, and they are managed through medication. So at the end of the day, we need to educate our people on treatment adherence. And all said and done, we are saying, again, how do we take care of ourselves as service providers, and how do we take care of the children KATINDA, this is an area where we always ignore bringing in the children for them to understand what is going on in the life of their loved ones. Providing information is another way of helping to manage PTSD. Let everybody in the family understand what is going on so that they also don't develop these signs much later, because what we call the vicarious.
I think we've just lost Elizabeth. We can't hear her well. But Elizabeth, I think we're losing you a little bit.
So at the mission.
But Elizabeth, we didn't actually hear the last sentence you said.
Sorry for that.
Yeah, just repeat the last sentence. We just missed the last sentence you said. You're talking about children and everybody passing information so the children know what is going on in the family. Okay. If Elizabeth, you're muted, unmute yourself. Thank you.
Sorry for that.
Network problems.
Yes. What was the question?
No, you were talking about passing information to the children and letting them know what this is all about, educating them on the condition of a family member with PTSD.
Yes, that is one way of helping us to manage this situation.
Yes. So is anyone else who wants to add anything before?
The therapy that Dr. Elizabeth talked about is you don't have to do a traditional therapy. Sometimes you can do the way the family wants.
True. I think it's also asking them how do they want to be helped rather than you dictating to them what is supposed to happen. So including them in the process of healing.
Yes.
Yeah, that's very critical. Edith? Yeah. Abdi, you still talking?
Yeah, sorry, I'll give it to Edith. Yeah.
Edith, what would you like to add?
Maybe just advocacy, like civic education, because I'm sure that so many people don't know what like post-traumatic stress disorder is. So educating the community so that they are able to also offer the support in case they come across people who are suffering. Yeah, thank you.
Yeah, I think at the end of the day, education is the key, because if we educate, people get to know more about it and everybody's aware. So sometimes you could be the one suffering from it, and because of the stigma, you don't seek help. So it's about learning what are your triggers as well, because there's a lot of triggers, like Abdi said, like Edith, you said, when you hear a big bang, it freaks you out. When you hear balloon burst, it freaks you out because it reminds you of triggers, it takes you back to that place. So I think the awareness campaigns would be really good. It could be from the churches, the churches where people go, or the mosque, or depending where people really congregate and go to places where people somebody can educate in those kind of spaces, because it's easy. There's everybody everywhere, and there's families as well in that place. Yeah, so before we conclude, I know there's so many ways to protect and manage your mental health. What is one thing you do for yourself on a daily basis to check in with your mental health and soothe your soul? Abdi?
I probably would do something makes me happy day to day. Follow maybe my original childhood things that I used to do, and things that make me happy. That will I will have a good mental health that way. Whether exercising or whether talking to my own language, or rather than speaking English all the time. So I'll find friends who are similar language and similar. So you go back to your childhood thinking. I think that works for a lot of young people that I've worked with, saying, what do you like? And they say, well, my family used to take me this place. Then, you will say, well, do that. And I find that really works. If that makes sense, just being able to, be yourself and be happy.
That actually works for adults too, because all of us, like, even think about it, when we watch cartoon, what happens to us? We get excited, we sit down, we are happy. It takes us back to that little girl, little boy. And I think it's critical to connect with that, because that is still there. That doesn't go away. It's still in us. So yeah, that's a good one. Edith, what do you do to connect with your mental health, to connect with yourself, soothe your soul on a daily basis?
Okay, mine is prayer, like for my spiritual well-being. So prayer is very important to me, and also meditation, and just being vulnerable to people that are close to me, like my friends, and having meaningful friendships. Yeah, just not having friends for the sake of it, like people I can count on in case I have an issue. Yeah, and physical exercise.
Yeah, that's
Thank you.
fantastic. Fantastic. I think we lost Dr. Elizabeth there. So, as for me, I have a routine which I always like to encourage people. I have a gratitude journal. I write down three things when I wake up in the morning. What are three things I'm grateful for? And how do I want my day to be? All those things where you get into the feeling of gratitude, because we have such an amazing life, but sometimes we forget to be grateful for the things that we don't see, the things that make us who we are, for breath. I'm always every day saying I'm grateful to wake up and have breath, because without breath, we are nothing. We're gone. So it's just being grateful is one thing which is very critical for me, but as well exercising, drinking a lot of water, because it's critical to hydrate, and meditation as well. So those are the basics for the day. Sort of you ground yourself, you get aligned, and
Mhm.
you start your day in a very positive way. And also, like Edith said, keeping positive friendships, people who help you grow, people who help you excel and be the best thing you can be, rather than people that break you down. Because when we're talking about, for example, PTSD, you don't want to be maybe suffering from something, or depression, or whatever it is, some sort of mental illness, and the people around you always break you down, and they're always your triggers. That means you're always in a very negative spiral place. So I think the friendship thing, finding meaningful friends, is very critical for me, as well as, like it said. So yeah, that's amazing. So now, before we go, where can people find you, Abdi? Where can people find you if they wanted to find you?
I'm social media has also my email and my contact number, LinkedIn, and mainly if you want to looking for my number, but also if social media, if you don't use social media, just ask your friend to find LinkedIn and they can contact me through that way. And technology changes these days. You can find people in different ways. But also, I just want to say quickly what your question was. Three of us has actually said the same thing. If you look at it, finding, the prayer for yourself or whatever, you're taking your childhood and, doing a journal, all comes down to when we were young and being grateful. So, yeah, but you can find me anywhere, as I said, or people who don't find me, they can contact you and then you can give to my contact. Thank
So
you.
would that be the name on the screen, Abdi Aiden? Is that the name they
Yeah,
would find?
yeah, Abdi Aden is a very common, in Somalia. I wish I had like Jamal or something very different, but Abdi is like everyone. But and I don't wish anything. I always, but that's one thing that and one of the thing I tell the young people when I speak to them in inspirational is, you can be successful having your own name. You have to change your name, and it's empowering in that way. But Abdi Aiden is very common, but find the one, an inspirational speaker, author, or youth worker that will work. Thank you.
What I would suggest is, after this broadcast, just type on the Facebook, on the comment, just put your details there so people can actually find you directly.
Thank you.
Especially if you study, there's so many Abdis, so just to save them the hassle of looking for you.
Yeah.
Yes. What about Edith? Where can people find you?
Mine is very easy. Like I use the same name everywhere. So it's very easy for people to find me on my social media platforms, on GYMHA, through email. It's very easy. Yeah, it's just that name. Yeah, thank
Thank
you.
you.
Yeah, you got a nice name. I thought maybe it was a stage name, but that's your real name.
Okay, thank
And
you.
also, you can find more information on the Global Youth Mental Health Awareness by visiting our website, which is www.globalyouthmentalhealthawareness.org, or you can email Jude at gymha.org. So if there's any, with all those details will be on the post. So if anybody's watching and you have any questions, please, we're about to end the show. So if you have any questions, this would be a good time to ask Abdi or Edith any questions about PTSD. So Abdi, while we're just waiting to see if anybody has a question, what is your message to the viewers today? What would you like to leave with our viewers today?
I'd like to leave the views that we, as community, we try the best we can to support the community. So it's, you put me on spot on. I haven't really thought about too much, but just being able to communicate, and basically, I'm not a type of person who shy away asking questions, and I think that people just please do ask questions, and we're very genuine. Myself and Edith, I can speak for you too, but just ask questions, and that's what I'll leave a message. Don't shy away, because sometimes when you don't ask questions, that's where you interpret things differently, or you leave it too long. So that's what I can say. More just the talking as community, and please do contact, and if someone contact, I'll just always message back and explain to things. Yeah, thank you.
Thank you. Yeah, I think the other thing too is people should feel encouraged to actually seek help and ask for help, because I know that's the biggest stigma we have about any sort of mental illness. We're all afraid that people are going to judge us, people are going to know that we have a problem. And because of that, we keep our problem, and then it becomes worse and it gets out of control. So yes, definitely ask for help. Don't feel afraid. Nobody's here to judge you. We are here to support, to help. And that's why we do this kind of shows. So to encourage our viewers or anybody who might be watching who knows someone who might need help. So please feel free to seek help. Don't feel judged, because that's not what we're here for. We're here to encourage, to support, to help you in your healing journey as well. So Edith, what is your message you'd like to leave to our viewers today?
Yeah, like you've said, I would also just tell people that it's important to reach out. When we bottle up emotions, it will reach a time that it will blow up and explode in a very negative way. So seeking help early is important, reaching out to people you trust, and you'll find help that way. Because when you keep quiet, it's very hard for people to know that you're going through something, unless maybe it's a professional. So seeking help is very important. And also to other members, like the community members, let us not judge people when they reach out to us, because like mental health illness can happen to anyone. So it's important that we don't judge people. Let us be like the safe space for people. People will feel free to reach out to us and find help. Yeah, thank you.
Thank you. Yeah, I see here we have some comments. Rishikesh Kumar says, great discussion going on. And Jasmina Sadrovsky is saying communication is vital, being comfortable and to reach out. Spot on. Yes, definitely. I think we're all talking the same language. Seek help, ask for help, please just get out there, talk about it, find people you trust. Of course, this is where it gets really tricky, because you have to find people you can trust. And that's the one thing I think most people struggle with when they don't know where to go, who to go to. And if they can't go to a professional, your immediate group, friendship, family, if you can't speak with them, it gets really difficult. So it's a question of finding out who can you trust, so they can sort of give you a way to open up and maybe direct you to the right place to get help. So
yeah, I'll just quickly want to say also confidentiality. So if people contact you, you just have to provide that everything you tell me about this confidentiality, so people can trust you that way. Because sometimes people might like you to tell you, but they don't trust. So making sure when someone contact you, you tell them this is, I'm not going to tell anyone one way or the other. Like a lot of my community, when you don't talk to the doctor, because that doctor, everyone goes there. So they're worried about sometimes the doctor's the community, and the doctor might not tell anyone, but you just got that conscious about it. So make it very clear as a service providers that when people contact you. So that's my actually belief. If people contact me, ask me something, I always will tell them that this is just between you and I, if they don't understand that. So that's very important. Yeah, thank you.
Yeah, I think Abdi, you're talking about that. The reason why people don't trust people a lot, it's not so much because if it's a professional, you're kind of okay. It's
Yeah.
because of what's happened in the past. Like you talk to somebody who you think you trust, and then the whole community knows that you've got some sort of a problem. So that means you shut down and you struggle with your problem because now if you don't know who to talk to and where to go, it's only going to get worse from there until something's really bad and then there's no choice. But I think it's just learning that we need to start using our platforms, whether it's your professional, whether it's friendships, to just be able to provide that, trust to help people to be able to actually seek help without feeling everybody's going to know about it. Because I know, especially the African community, that's been the biggest problem. Like nobody wants to say anything because they know everybody's going to know everything about them. I don't know whether it's an African thing or it's a human thing. I'm not sure, but it's a very big problem.
I think it's a human thing. It's not only African thing because often other cultures also have the same problem. but generally, it's good to have general, and then like, and the other thing is people trust you if you don't tell anyone. So you have to build your trust. You mentioned that before, that friend or tell you. So you have to be really build your reputation that you are a very genuine person. So the word I always say is genuine. You have to be genuine. If someone come to you who's opposite to your gender, don't judge. Sometimes your face will tell. People think, oh, I won't tell anyone. But if you don't look genuine, and that's where people look. So when I say, I mean it. So that type of trust that you were talking about, not only professional, but also friends and community.
Thank you. So I want to thank you, Edith. Dr. Elizabeth has disappeared. I think she got network issues. And Abdi, for sharing your insights on post-traumatic stress disorder today.
Yeah.
That was amazing. I learned a lot myself. Like there's a lot of things I didn't know, and I always feel so honored and grateful because this platform educates me as well as the viewers. It's not just we're doing this show, but we're all learning as well. And hopefully, everybody watching, please always remember to ask questions, contact the panelists if you have any questions and you want them to answer. If you know anyone who needs help, you can always reach out. And I want to thank you, viewers, for being a fabulous audience and for watching the Global Youth Mental Health Awareness Show. Now, our next fortnight's topic is the Stress Management Revolution Summit 2021. It's coming up soon, so we'll be talking about what is going to happen at that summit. And until next time, may all your experiences and life bring you love and light. Stay blessed.
Thank you.
Bye.
Bye for now.